person? If they ask, answer how you want.
Thank you.
Yeah, right here. We asked you here to give your opinion on 4 different cases the defendant performed. What surgery did the defendant recommend for Jerry Summers?
An anterior cervical fusion at C4 and C5.
What was the outcome of Mr. Summers' surgery?
He was rendered a quadriplegic.
Would you walk us through it?
There was a lot of bleeding.
Sergeant. Sponge. Give me a sponge.
How many cc's were lost?
Typical loss is somewhere between 25 and 200 cc's. Mr. Summers lost 1,900 cc's.
What accounts for that amount of blood loss?
Injury, lacerated the
The defendant chose to go back in for a second surgery. What procedure did he perform?
a laminectomy in order to relieve pressure. But by removing excessive bone, both the front and the back, you're compromising the entire structure.
In layman's terms,
His head was barely attached to his spine.
Wow.
let's move on to Shelley Brennan. The surgery Dunch recommended, was that a surgery that would fix her issue?
Yes,
What was the outcome of Mrs. Brennan's operation?
she died.
Is that normal for this type of procedure?
Mortalities are less than 1 in 10,000. The pituitary rongeur went through the ligament in the front and lacerated the iliac vessels that lie directly on the side,
So, Mrs. Brennan was bleeding.
heavily.
Would there have been blood visible in the operative site?
Sometimes yes, that doesn't appear to have been the case here, but they should have noticed a drop in her blood pressure.
Should a neurosurgeon know that a drop in blood pressure means there's a bleed somewhere?
It's a fundamental rule, but the likelihood of them being able to address the issue is small. They call it a vascular surgeon for assistance.
But he didn't do that. Dorothy Burke.
Mrs. Burke had a previous anterior cervical fusion at C5-6 and C6-7 that resolved her symptoms for a time, but she began experiencing neck and shoulder pain that had nothing to do with her prior surgery. Dr. Dunch diagnosed a disc protrusion at C4-5 and a disc extrusion at the C7-T1 valve. He sliced through the vertebral artery again.
We've been talking a lot about the vertebral artery. Is it common for it to be hit during surgery?
Exceptionally rare.
How many times have you hit it?
Never.
And what happened to Mrs. Burke after her surgery?
Her heart rate elevated. She couldn't open her eyes. No verbal response to questioning or commands.
And what does that indicate to anyone in the medical field?
An impending disaster.
What should Mr. Dunch have done as soon as he was informed of that information?
Physically examine the patient.
That's you.
Studies and scans. They were ordered by the ICU physician, which showed she was brain dead.
Where was Dr. Dunch?
He was operating on Madeline Bayer.
Had the defendant focused on Dorothy Burke rather than Madeline Bayer, would she still be alive today?
Based on what I know of Dr. Dunch's approach to surgery, Mrs. Burke was
Objection.
Sustained.
Madeline Bayer.
Mrs. Bayer is the reason I'm sitting here today. I tried to fix her. One of the screws was violating the spinal canal, damaging dura and nerve roots.
How do you know when you hit the dura?
Cerebral spinal fluid leaks out. I found evidence of 3 attempted screw placements on the left side, but no screws. The most disturbing part was the entire reason he was operating was to remove the disc, and he didn't touch it.
What did he take out?
A large piece of the psoas muscle. He made a port through that muscle and stuffed an implant.
Ed?
Is a trained neurosurgeon going to know the difference between bone and muscle?
Oh, yeah.
Would a trained neurosurgeon know that by malpositioning the inner body device, he was reasonably certain to cause her injury? Would a trained neurosurgeon have been aware that if he malpositioned the pedicle screws, he was reasonably certain to cause her serious bodily injury?
Yes.
Would a trained neurosurgeon have been aware that if he amputated the nerve root, he was reasonably certain to cause her serious bodily injury?
Yes.
The way the surgical tools were used in Madeline Bayer's case, do you think they were used in a manner that was capable of causing death or serious bodily injury?
Yes.
We pass the witness.
Dr. Henderson, Miss Sugar made quite the point that a trained neurosurgeon should have done this or done that. You're aware Christopher has both an MD and a PhD from the University of Tennessee.
I am.
UT isn't some fly-by-night medical school. It's not like one of those in Guadalajara or Granada, is it?
No, it's in Memphis.
Do you know Dr. Jeffrey Skadden? Does he have a good reputation?
I do, and he does.
And what was he responsible for in Christopher Dunch's training?
After Dr. Dunch finished his residency at UT, he came under the tutelage of Dr. Skadden for fellowship training in minimally invasive spine surgery.
Were you familiar with the fact that Dr. Dunch was doing medical cancer research on the side and that Dr. Skadden was involved in that research?
I wasn't at the time, no.
Should any doctor under any circumstances have their surgical training hours disrupted by research?
Absolutely not.
So, a neurosurgical resident or fellow can't just skip those hours. The supervisor has to sign off, no matter the excuse.
Correct.
Do the doctors in charge of the program have to sign off that they're qualified to go and operate?
Yes.
Did Dr. Skadden write letters of recommendation for Dr. Dunch?
Yes, he stated Dr. Dunch was a satisfactory surgeon.
Or had Dr. Skadden heard what was happening in Texas?
Yes, because he had mentioned poor outcomes for Baylor when filling out a credentialing form at Forest Park.
Do you have any idea why he wouldn't have explicitly told these hospitals not to hire Dr. Dunch?
Dr. Skadden said that he had to write recommendations based on what he'd witnessed in his program. He couldn't speak to whatever was happening in Texas. He didn't write any more recommendations for Mr. Dunch after we spoke.
Has there ever been an instance in which a doctor was sued for not writing a recommendation?